Cardinal Innovations and PVH before it were built in response to a very straightforward problem. And the problem is government is good at funding public health care, but not so good at managing and delivering that health care. And this is true whether it's Medicare or Medicaid, whether it's TRICARE or VA, or any of the other programs that comprise the public system of care. Cardinal Innovations is designed to capture the best of both. It's a new way to fund, manage, and deliver health care. And that's what's allowed us to grow into now the state's second largest health plan. What distinguishes Cardinal Innovations from any other health plan, any other model, public or private, is our local presence. Our member engagement, our family focus, our stakeholder involvement. This is what makes us different. If all we had was a call center, we could be like any other health plan. If all we did was local work without the efficiency and the corporate office to back it up, we'd be like any other local program. We can't work without both parts together. Both the folks who are on the front lines, managing the care, engaging the folks that we serve on a day-to-day basis in person, where they live, where they receive their care. But those folks can't do their job without the people that run the technology, that manage the human resources, that make sure we've got facilities to work from, vehicles to drive. So Cardinal Innovations wouldn't work without both parts together. It's a team effort.
And having a young child that you're told by the doctors is not going to be like everybody else is a tremendous blow and a tremendous responsibility, and it's something that you have to adjust to and learn. What Cardinal has done for Amber and I is been able to help us to navigate the really difficult maze of the managed care system, to where if I need a question answered or if I've got a problem, they're always there. Having Amber for these years has been the greatest blessing that I've ever had. I tell people all the time that I wouldn't have it any other way. She's the most wonderful thing that I've ever had. And being able to take care of her, for me, is an honor. And because of Cardinal, I can take care of her. She's the oldest living example of her condition that's ever been in the entire world. In my last visit with her neurologist, he told me, he said, "Rick, I don't know what you're doing. You're writing your own story, but just keep doing it."
I've been in the mental health and substance abuse field for well over 20 years, and I still am passionate about it. Most of the clients that I serve are immigrants. I offer the services in Spanish as well as in English, and they don't feel intimidated reaching out to me when I tell them, don't feel scared, I'm not going to report you, I don't need anything in terms of Social Security or any of that. Cardinal, when they approved me as a provider, it actually opened up doors for many of the clients who were waiting. For them, it's almost as if, oh my gosh, finally someone who can speak my language and accepts the Medicaid. That for them, it's really, really a blessing, they say to me. It keeps the system working really well. It's an example of how the system should be working cohesively as a team. It is a reward when they come back and say, thank you so much that you were able to empower me to live a self-sustaining life. That's what I feel like I'm doing here, and I'm glad that I'm a part of Cardinal Innovations, who is giving me those tools to be able to do that with consumers.
Even though I've managed to overcome a lot of the challenges associated with autism, it still will always be a part of me. I'm going to gain what I can from it and try to overcome the negative aspects. That's what's kind of empowered me to take on and become more confident, is the challenges that I faced. Challenge yourself, really put yourself out there. You can sit in your room all day and watch Star Wars and do whatever, but At the end of the day, it's the people that you meet and the interactions that you forge that are going to really make you progress in the world. I wouldn't have been able to live on my own if it weren't for the support that I have been receiving, and as a result of the work that I've been doing, in a combination of that is why I'm able to live on my own. So I'm really starting to see a future for the first time, and it's a really empowering feeling.
According to the National Institute of Mental Health, roughly 1 in 4 Americans have a diagnosable behavioral health issue. Mood and anxiety disorders are the most common psychiatric conditions seen in primary care, yet remain underdetected and undertreated. The reason? A lack of behavioral health screening tools. With M3 Clinician, you have a cloud-based tool that screens behavioral health conditions such as depression, anxiety, bipolar disorder, PTSD, and more. Unlike other paper-based or automated screening tools, the process implements screening that can be taken during annual checkups, in the waiting room, or even remotely. M3 Clinician assigns a numeric value that you review in real time. The results help place the patient on the clinical map, providing insight on what the best medical pathway to recovery may be. Our system is highly adaptable to your practice in any healthcare organization, providing packages to choose from that only come out to $3 per screen with no long-term contracts or hidden fees. There is no startup investment or software to install, making it a highly cost-efficient option for your practice. The tests are available in both English and Spanish and only takes a few minutes to complete. Don't let your patients suffer in silence any longer. Integrate M3 into your practice and simplify the process of your diagnosis. M3 Clinician, a deeper understanding of your patients. Sign up at m3clinician.com today.